defend absolutely any, messed up system or practice. But in all of my, I don't think I've ever heard anybody take the position that, our healthcare system is great. This is how healthcare should work. So maybe, I wonder if we could maybe talk a little bit about this, deep skepticism about healthcare and where it comes from. Uh, Maybe Dom or Corey, whoever wants to jump in. Um,
I, yeah, I mean, I think it's fascinating because I think that the whole MAHA movement has picked up on something. I mean, there's a certain genius to it, is they've picked up on something that's real, which is this distrust in the healthcare system. I think they've recognized that there are some really big problems in the healthcare system, and then just have managed to twist that into something different. So I think people really um, have had terrible experiences in our healthcare system because our healthcare system is so messed up. Like it really is. It's built on a for-profit model, and so the what we're trying to get out of that is like healthcare commodity and not people living their best lives. And so I think because our healthcare system is set up in this horrible way that has health insurance profits and pharmaceutical company profits, and hospitals trying to meet budgets and all these kinds of things as the focus rather than trying to get people healthy as the focus. And I think people recognize that and they see that. But instead of saying, like, hey, the problem is that we have this for profit healthcare system, and maybe we need to look at something like, a single payer or a universal healthcare system where the focus is on health, they say, oh, it's, because medicine is killing us. And so instead we need to take like high dose vitamin C or, whatever. And then you get the influencers and the supplement industry. And I mean, the ironic part of it is that they're going away from the healthcare system to go to an unregulated system of like influencers and kind of all this other stuff. But at the root of all that is this recognition that there is something deeply wrong with our healthcare system. And so I think they've identified the problem correctly. It's just where you go with that is what they've exploited. If that makes sense, I don't know.
is that something you've seen in your work as well, Dom? Either in nursing or in your public health advocacy?
Yeah, I think Corey is exactly right, and I think this sort of like questioning of authority is ha- it's in general we've seen a really big questioning of authority, of course with things like mainstream media and our government generally, um, and big corporations, and as Corey said, they're getting to the point where these these big corporations, the healthcare industry, the pharmaceutical industry, mainstream media, so on, and whatever, um, do have a a profit motive rather than delivering correct information, taking care of patients, not putting people on X amount of drugs and so on and so forth. So she's correct that people are identifying that there is something wrong with the capitalist system in general, and of course our healthcare system, by extension of that. Um, and I think this also again has a toll on workers in the healthcare system. I just finished my master's thesis in public health at Temple, and I did my thesis, my research with the local nurses union, and one of the biggest things that they're pushing for is patient ratio. So one nurse only being allowed to have four patients or however many patients depending on the kind of unit that that nurse is working in, because we're seeing a lot of burnout in the healthcare industry, not just because of skepticism, but also because people are are getting sicker, because there is this this drive to not really care for patients but just make as much money as possible. People are getting sicker, and in turn that's really causing a lot of burnout for healthcare workers. And people leave the job, and then the companies don't want to hire more staff to take care of these patients who are really really sick, and that causes more burnout. So there's just like self fulfilling prophecy, continuous cycle under capitalism that we're seeing, where patients are unhappy, workers are unhappy, people generally are unhappy, and the only people that are happy with all this going on is the ruling class, the capitalist class. So, like I said, it's really just this self-fulfilling prophecy, continuous cycle that we're seeing of people just really being discontent with the system as a whole, and of course, the healthcare system by extension.
I think Dom's point about about like the staffing ratios and things like that is so important. The importance of the union movement within healthcare to protect patients, I think, is really one that needs to be really brought forward. I mean, we think about the union movement, to protect workers, but I think especially in healthcare and education is, I think, the other place where we see this a lot, where like the teachers union really fights to protect their students and their students' rights to education. I think when you look at nursing unions, they're obviously fighting for workers' rights, but that is really about patients' rights, like making sure that patients are safe, that patients are protected. And I think extending, the union movement within nursing is so important. And really, we need to extend that to doctors too, because the same applies to those and physical therapists. And, I think healthcare as an industry needs a lot more union protection for patients' sake. I mean, if this is the system we're going to have, then within that system, we really need to, try to protect patients that way, I think.
Yeah, no
Yeah,
one,
and
no one
and
wants a healthcare worker who is burnt out and tired, because that's when med errors happen, and that puts the patient at risk. So that's why I agree that the union movement in education. My partner is a teacher, so I see that as well, and in the teachers union here, but also in healthcare, because when again, it's not just about the workers, and I think even the workers recognize this. They, of course, they want to have a good fair wages and a good workplace, but they also recognize that half the battle, or half of this, is about the patients and making sure patients are cared for in an adequate way. Because they know that when healthcare workers and nurses are burnt out and tired, that's when mistakes happen, and it could be life or death for a patient.
And
absolutely. Sorry, no, go for it, Corey.
no. So there was just thinking back. There was one other thing though that always occurs to me when I'm talking to people about vaccines that I just think is interesting. Um, so I trained in Cuba. That's where I did my medical school. And Cuba has one of the greatest healthcare systems with very low resources. And it's always interesting to me because people talk about vaccines as like, oh, they're just trying to get money out of it. Like this is just like this is for the profit motive, whatever, which is interesting because a lot of things in healthcare are just done for profit motive, and people are right in that instinct. Except that I don't think that's true of vaccines in general. And Cuba is one of the most kind of pro-vaccine places I've ever been in my life. Like it's a very interesting training there because there is no vaccine hesitancy in the country at all from the 6 years that I spent there. Nobody even thinks to question the idea of a vaccine. In fact, while I was there, at one point, I got a vaccine just walking out of a classroom during one of our classes. There was a nurse standing there with a bunch of syringes, and they're like, you guys are all, you all need a meningococcal vaccine because you guys live in dorms. So, roll up your sleeve, let's go. I mean, it made me think of like when the polio vaccine came out and they were giving them to kids at school. And nobody questioned, you just get it. Like it was fine. I was very happy to get it. At the time, that vaccine wasn't even available in the US because Cuba had developed it and it hadn't gotten here yet. But it just always makes me kind of, like if Cuba's doing it, then it's not something that you should really question here. Like clearly with that support, this is not part of the capitalist kind of movement. This is something that really is I mean, I don't think any of us in healthcare really question whether vaccines are a good thing or not. I think we all know that they are, but that's just a check for me. Like, yeah, vaccines of course are good, and like, Cuba, who's one of the foremost in healthcare, this is a huge part of what they do. So
It seems like sort of what's kind of emerging in talking both about the importance of organizing in healthcare and in talking about vaccines is uh, kind of a difference between individual and collective approaches to healthcare. Because if we, vaccines are something that really don't. It's not sort of an individual thing. I mean, it is because the individual gets protection, but it's about generating herd immunity, um, uh, and making sure that even people who can't get vaccinated for one reason or another, are still protected because the population as a whole is vaccinated. And if we think about the sort of the working conditions question and the burnout and staffing and all of that, it's like I feel like sometimes there's an effort to push stuff like mindfulness, like um, take time to meditate or do yoga or whatever, rather than thinking about this broader collective. So I wonder if part of what the Maha movement is doing is trying to push this deeply individual and anti-collective approach um, to healthcare. Um, so I don't know if that makes sense in from what folks have seen otherwise. And our producer, by the way, Brooklyn is our producer today. Thank you very much, Brooklyn, for your work on the show. Pointed out that yeah, measles cases are on the rise, which is kind of terrifying. Dom, measles, like the decline of measles immunization is really terrifying from a public health perspective, from what I've heard. Could you um, talk a little bit about that for us?
Yeah, it's terrifying and also just frankly really bizarre. Because I don't think anyone wants measles. I can't imagine that someone wants measles or thinks, "Oh, measles is no big deal." I think I hear people say that about varicella, which is often in the, there's a vaccine where you get, measles, mumps, rubella, and varicella, the MMRV vaccine, and they're often given together if they are, if someone were to get those vaccines in a separate formulation. I hear people say, "Oh, I dealt with chickenpox when I was a kid," and so on and so forth. But I've never heard anyone say like, "Oh yeah, like measles is no big deal," because it is a big deal. And if it's not a big deal to you, it could be a big deal to your neighbor or your classmate or your coworker or whatever the case may be. And I think you're hitting the nail on the head that a lot of this is sort of like the individual thinking versus the collective thinking, and I think that sort of is a trend just generally in our healthcare system. We see there, and I think Maha and RFK are really taking advantage of this like de-emphasis on primary care, because a lot of people don't in this country don't get primary care, and that's why we see all these sort of like comorbidities like heart disease and cancers and uh, diabetes and so on and so forth. Really high here, and people still and more so previously have passed away and died before these things that are really preventable, especially through primary care. And it's as a healthcare worker, it's fascinating to me to see the Maha movement really take a hold of real grievances that people have, as Corey said, with the healthcare system, because we know that it doesn't work for us, and directing it towards uh, uh, something that is not going to fix the issue. Of course, we know that Medicare for all, not Medicare for all by itself, but Medicare for all is one of the biggest fixes to the issue. Having a more of an emphasis on primary care, like they do in other countries who have better health outcomes than us, um, is a big fix for the issue. Addressing racism in the healthcare system would be a big fix to the issue, particularly because lots of Black and Brown people had a distrust of the healthcare system way before COVID and way before the sort of stigma around vaccines came up, and also creating an infrastructure that makes it possible for hospitals and primary care clinics to exist in rural parts of the country where they don't exist, where people have to travel, hours to get care, and because of that, sometimes people just forego care because they can't afford to travel to go get that care. Those are all things that that would address these sort of issues that people have that MAHA is sort of directing people uh, away from.
Yeah, and thanks for bringing in the sort of racist nature of this attack on public health and sort of the health impacts of racism, because it's, I mean, they're enormous. Corey, I remember you were sharing some data with me at one point about maternal mortality between, which is not only increasing across the board, but is absolutely spiking, in fact, um, in among Black women. Um, so I guess, this is a good time to kind of talk about some of the other, aside from the MAHA sort of anti-vax, influencer-driven stuff. There's another wing, I think, of the Trump MAGA attack on our health, which has to do with the gutting of civil rights protections, and the way that you know government funding is being withdrawn from projects that uh, track health data for racially and nationally oppressed people, or for women, or for LGBTQ people, or the attack on healthcare for trans people. Right? These are things that I was wondering if either of you or both of you had a sense of what the impact of these changes, these funding clawbacks, are going to be, kind of down the line, or on our healthcare system more broadly.
Yeah, I think there's a longstanding issue in and I'm not a researcher, but just in general, a longstanding issue in healthcare research of not, um, kind of covering our population as it actually looks, and this focus on basically like white men as the population, as the base population that are being studied. And so I think, in the last couple decades, we've been trying to dig out of that, and there's been a lot more focus on making sure that we're really studying the right populations. And I think, you know, this is a this is going to derail some of that digging out that we're trying to do. Um, it's going to move away from that, and obviously looking at things like the maternal mortality rate going up among Black women, like we're doing something wrong because it is going in the wrong direction, and it was already much higher in that group to begin with. So I think that's obviously um, a big issue on that point.
And this is, I think, maybe also an opportune time to wish all of our viewers a very militant and joyful Black History Month. February is Black History Month, so this is maybe a time to uplift some of the great. I mean, the struggles for healthcare justice and racial justice have always been intertwined with one another, and we think about some of the great Black public health heroes. Dr. Kizzmekia Corbett, whose research in viral immunology was foundational for the COVID vaccine. Dr. Jocelyn Elders, right, whose advocacy for reproductive choice and for science-based sexual education was, ahead of its time, and changed the national conversation, and drew intense persecution of her. So, and also, of course, the many Black Americans whose contributions to healthcare have been exacted without their consent. So Henrietta Lacks and Anarcha Westcott, and the patients of of J. Marion Sims, who pioneered many gynecological surgeries by experimenting, in fact, on enslaved Black women. So the fight for racial justice and healthcare justice, they're inseparable from one another. And So I think this would be a good time to start looking to what are the solutions to this deep crisis. So we have the general capitalist crisis of healthcare, right? The for-profit system that's burning out our healthcare providers, that's making our patients, making all of us sicker and sicker, um, and generating huge profits for private equity and for insurance companies and for pharmaceutical companies. Uh, and we have the uh, you know, supplementary crisis of the fascist attack on healthcare. So the attack on science and the attack on civil rights. So what are we thinking of going forward after Trump? What are the policies that we need to put in place? I mean, Medicare for all, Dom, you mentioned, is a huge one. But what kind of in the small immediate picture, minimum program, and also in the bigger picture? What do we need?
I can just say really quickly that like I said, like of course we need, Medicare for all, but I think we also have to fight for, in the same way that there were other things tied to Obamacare or the Affordable Care Act that sort of like go under the radar, like things like incentivizing doctors to work in rural areas. We need to make sure that if and when Medicare for all, universal health care legislation comes to be, that there are other provisions included in that, like addressing medical racism, like ensuring that we are building infrastructure in rural areas to make sure that those people um, can access healthcare. Because it's one thing to make healthcare affordable; it's another thing to address actually being able to access that care, and what are the barriers to accessing that care. Like racism is a big barrier, like geography and location for rural folks are as a big barrier. And I think in the grand scheme of things, um, a lot of this really does, as I said in the beginning, have to do with who is viewed as an authority, and who isn't. Influencers have become the authority on many different things, not just healthcare. And that really, as someone who kind of worked in the intersection of education and healthcare, I was a school nurse for a while. That really, terrifies me. And it's not to say that we shouldn't question authority and we should never question why something is happening or why someone is saying something. But I think, again, like I said, this sort of like anti intellectualism has gone, and the MAGA movement has taken it in a completely, has diverted people's attention away from the real root of the issue, which is capitalism. Um, and in that, I think, of course, like I said, there's the economic fix to this that we of course need to fight for, but there's also sort of the democratic and social fixes that we shouldn't shy away from, and it's like anti intellectualism, especially when it comes to black folks and LGBT folks too. I mean, I think of something that I think all the time this is kind of a tangent, but when it comes to LGBT people, like the question of trans people in sports. And I think it's a as a trans person, it's a fine question to have. I don't think that we shouldn't be questioning it, but who I don't want to be like the leading person making that decision, a person whose last athletic experience was JV football in high school or JV baseball in high school. That's not an expert. These some Republican politicians who have never played a sport in their life, or the last time they've done anything athletic was decades ago, should not be the ones uh, people were listening to when it comes to these sorts of things. There are healthcare experts, there are body science experts, athletics experts that we should be listening to, that have the answers, or at least be taking guidance from, in combination with what's needed for society. So I think, like I said, on the one hand, there's the economic issue, and on the other hand, there's a bigger issue like anti-intellectualism, and sort of democratic issues that play a part in access to healthcare.
Thank you. Um, and Corey,
Yeah,
did
so I think to me, like there's the immediate things, like I think we need, universal health care of some sort, Medicare for all or something along those lines. But I think big picture, like we need to shift the focus of how we approach healthcare. I think a lot of the like influencers are, anti-medication and anti-pharma, and like we need to eat different and those kinds of things. And I think that there's something to that. It's just that all of that is based on this very individualistic, like personal responsibility. You need to figure out how to do it better. And I think that we need to approach healthcare like we do everything else as a collective. So we need to think about how to make ourselves healthier collectively. And that means by building healthier structures in our society. So that means like our jobs have to be better. We have to work less hours so that we have more time to do other things. We need to have like access to places to exercise and participate in sport. We need to have the time to do that and the place to do that. We need childcare so that you can drop your kids off and go do those things. We need access to good food so that we can eat healthy. We need to be able to take time off of work to go to doctor's appointments. Like, I think we have to look at this collectively and in that bigger picture. It can't be like you have to go to the gym and eat healthier and do all these other things. We have to look at what kind of system we're setting up and how we're helping people set themselves up to be better, and to do those things better. Just like vaccines don't work on a one-on-one basis, I don't think any of this stuff works for one person or another person. We need to set ourselves up as a society to be healthier. So we need to have healthier food choices. I mean, we have to have less cars and more public transportation and more walkable streets. And we need to have that kind of bigger view of what our society looks like so that we can live like as a healthier society overall. And all of those play really big into the mental health issue, which is a whole other like mental health crisis question that we could get into. But.
And the other thing I forgot to mention is also we need to increase union density in the healthcare industry.
Mhm.
Like I said before, and Corey was also talking about, it really does play a huge role in patients' lives, and also I think as we've seen manufacturing jobs sort of go down, lots of the healthcare industry in terms of employment is going up. There are lots of people who are increasingly working in the healthcare arena and also the education arena, but healthcare is one of the biggest areas of employment for people in this country. So we need to increase union density there as well, of course, for the workers and the patients.
Yeah, like in the teachers union in Chicago, people said teachers' working conditions are students' learning conditions, and as we said here, it's the same thing in healthcare. So, and this on the level of the individual versus collective solutions, that kind of gets into I think the anti-intellectualism thing as well, right? Because science is a collective enterprise, right? It depends on, if we think about the scientific method and the way that good data is generated, it has to do with, repeatability of experiments. It has to do with, kind of building up bodies of evidence for things. And, that I think that the anti-intellectualism is, in a certain sense, an attack on that collectivity, maybe kind of as well. And
Right. Sorry, that idea that like, well, in my opinion, like you don't have opinions in science. We collectively come up with a body of information. There is no individual opinion in science. That's not how it works. Yeah.
yeah, and I feel like that's something that needs to be that's kind of broadly under attack, right? Because who funds research? Well, pharmaceutical companies, and it's going to get worse because the Trump administration has slashed government funding for basic research, like the kind of stuff that undergirds other scientific developments, right? So we're
Right.
going to become more and more dependent on that private capital to fund. So we really need, I think, to work on that end as well. Like, how are our universities structured? How is funding allocated? Um, and we've got a few minutes left here. And Corey, you mentioned that you trained medically in Cuba, and the system there works very differently. We know that Cuba is under attack right now, not only the continuous attack that it's been under since its revolution, the victory of its revolution in 1959, the blockade has been going on for 60 plus years, trying to strangle the island. And now there's a new declaration from the Trump administration that Cuba is an extraordinary threat to the United States. So, threatening tariffs on anyone that provides oil. Um, so I wonder if we could talk a little bit about the Cuban model and about Cuba solidarity, and why that's so important here in terms of changing our understanding of healthcare. So, Corey, maybe could you tell us just what your experience was in Cuba, how it's different in terms of how medical care works?
Yeah, after the revolution in Cuba, they initially kind of struggled with not having the kind of personnel and infrastructure in healthcare, and so they kind of had to build a healthcare system, and that was one of the big focuses at the beginning of the revolution, and they really kind of came up with their own kind of way of organizing healthcare. Um, and it was a really primary care focused healthcare system that was just very intensive and built on that relationship of the primary care doctor and the patient. So the way they kind of set things up is that there are primary care docs who work in a team with a nurse, and so each doctor nurse pair is given an area that they cover, usually in a city like 2 or 3 blocks with a few hundred patients, and those are the patients that they're assigned to, and they do all of the primary care for those people, and they do a lot of home visits, and they're just kind of available to those patients. And then a group of those are called just clinics, and then a group of those clinics will be assigned to a polyclinic, which is like kind of a slightly larger small hospital that has some specialty care, and then a group of those will be assigned to a larger hospital. But they organize this whole system with the basis, the core being the primary care doctor nurse team, and that relationship with the doctor, with the patient, and really focused around like kind of the family, and to the extent that like the doctors have lists of all their patients, and they go to their homes and they do like these inventories of what their risk stratification is, and they do a lot of epidemiology and public health kind of focus, and just kind of fascinating. Like they'll be like, oh, I've diagnosed 6 cases of chlamydia in the last couple weeks, like let's go figure out what's happening, that like this is happening. Or oh, I've noticed a lot of asthma exacerbations in the last couple weeks, like maybe we need to look and see if there's something going on with the air quality around here that we need to like report so that that can get fixed, those kinds of things. So it's really fascinating system, very different than what we're used to seeing here.
And in terms of Cuba solidarity work here in the United States, um, like I feel like we tend to think of it sometimes like unidirectionally, like we need to support Cuba because Cuba is under attack, which is very true. But I feel like getting to Dom's point about the anti-intellectualism or whatever, the attack on our ability to know things. It's also like we've been cut off, right, from a huge amount of knowledge about how to organize healthcare. Dom, have you been involved in Cuba solidarity work? I believe so, right?
I haven't, but I totally resonate and agree with what you're saying, that it like I didn't even know that Cuba developed the meningococcal B. I'm assuming the meningococcal B vaccine. So these are the sort of things that we, because of uh, um, anti-communism, that we're sort of healthcare workers, and people who work in healthcare and public health are sort of cut off from that knowledge. So no, I haven't myself worked in Cuba solidarity work, but I totally resonate with what you're saying, because this idea that the United States has all the answers because we're the number one capitalist country, or whatever people say about us, when there are people from other countries and experts in other countries that are totally capable and have knowledge that would be beneficial for us.
Yeah,
Yeah, it was the Menb. They came out with Menb a few years before we had it available here, and and they had um, treatment for lung cancer that they came out that wasn't available for us here. There's all these developments that they're making, and honestly, we're cut off from all of those developments here because of the blockade. Um, that we're not able to access that. And Cuba has this long history of being, of providing care to the world. So they actually, went from that original state after the revolution of not having enough doctors to now they have more than they need. They just keep training them. And so now they do medical missions around the world, and they send doctors to other places to help provide medical care. And we are cut off from those services, throughout different times. When Hurricane Katrina happened, Cuba offered to send a plane load of doctors and supplies to help, and the U.S. refused it. But so we haven't been able to, fully enjoy the benefits of their advances and their kind of knowledge because of that break in relations between the countries.
yeah. So, I mean, I feel like everybody kind of understands like what, or everybody feels what's necessary, right, in our healthcare system, like a return to the human connection of patients and providers, and a system that values that, and instead, we have this, all of these distortions and manipulations to, attack science, attack our collective well-being, to keep profits flowing, and I think it's going to emerge. Is this like politically speaking, in terms of building the anti-monopoly movement, or building the movement that's going to take us from where we are right now, into the next step forward for society? Um, is is health is healthcare emerging in, I guess, in your work, Dom, and yours, Corey, as an issue that is capable of building unity in that direction?
Uh, I haven't seen it like emerge, but of course it's something that unifies everyone because everyone needs and wants good healthcare and access to healthcare. So I think it's something that us as the party and party members should really push to the fore, because it's something that really it crosses uh, uh, it crosses political affiliation and political thinking. It knows no race, it knows no religion. Every single human being in this country knows and wants healthcare, and even the sort of thinking about in terms of immigration, where people say, "Well, I don't want to pay for an illegal alien or whatever the hell they say to have healthcare. I don't want my taxes going to pay for them to have healthcare." And I think that really, of course, this is a bigoted and racist idea, and everyone deserves healthcare regardless of their immigration status and where they're from. But I think really at the core of that, I think is this idea that if they get healthcare, then I won't get healthcare. If they get healthcare, someone I care about won't get healthcare. And I think what we need to say is no. Everyone, regardless of you deserve healthcare, and so does this person whose immigration status is neither here nor there. We all deserve healthcare, and that the issue is these big, for-profit healthcare industry, healthcare companies and pharmaceutical companies that keep us from attaining that. It's not the case that this person who is an immigrant getting healthcare is taking away from you. It's the profit driven healthcare system that is taking away from you, not any individual.
Yeah. Dom, I think you have the last word. That's exactly right. Thank you all for joining us this morning. Remember to subscribe to our YouTube channel, share the socialist wealth, as Joe Sims says, and stay strong, stay safe, and stay in the fight. And also keep the pressure up on target. If you're not yet involved in the Target boycott movement, get involved there. It's a hugely important uh, front of the fight for civil rights and against fascism. Have a good weekend,